On a quiet morning in Afghanistan's eastern Kunar province, the earth shook violently. The tremor, measuring 6.0 on the Richter scale, lasted only seconds. But in those seconds, homes crumbled, lives were lost, and entire communities were thrown into chaos. More than 900 people have been reported dead. Thousands are injured, and the numbers are still climbing as rescue teams uncover more bodies from beneath the rubble. This was not just a geological event. It was a humanitarian disaster layered upon an already fragile nation. Afghanistan, long suffering from political instability, poverty, and international isolation, now faces one of its most devastating natural disasters in recent memory. The earthquake struck with brutal force. Entire villages built from mud brick homes collapsed within moments. Roads leading to the affected regions were blocked by landslides, cutting off survivors from immediate assistance. Power lines fell, communications broke down, and hospitals, already under-resourced, were overwhelmed by the influx of the injured. Kunar province, where the earthquake's epicenter was located, is one of the least accessible areas in Afghanistan. Mountainous terrain and poor infrastructure made rescue operations painfully slow. Many survivors were left to dig through the rubble with their bare hands, hoping to find relatives still alive. As days passed, images and reports showed children sitting beside the ruins of their homes, waiting for parents who would never return. Families gathered in makeshift camps, exposed to harsh weather, with little food, clean water, or shelter. The devastation was not limited to human lives. Livestock, crops, and local economies were also destroyed. This created a ripple effect of suffering that will last long after the aftershocks fade. Behind every statistic is a human story, a mother carrying her injured child for miles to reach a clinic, an elderly man sitting silently beside the rubble of his collapsed home, his entire family buried beneath. Children wandering aimlessly, searching for relatives in a landscape that no longer looks like home. Hospitals in the region are flooded with patients. Doctors, lacking proper medical supplies, are forced to treat wounds with limited resources. Some patients lie on the floor, waiting for care that may never arrive in time. International humanitarian organizations warn that without immediate assistance, preventable deaths from infections, dehydration, and untreated injuries could surpass the initial death toll. The psychological toll is equally devastating. Survivors carry not just physical wounds, but deep trauma, nightmares, grief, and the fear of another disaster. Communities that once stood together are now fragmented, with many residents forced to relocate in search of aid. Why is Afghanistan so vulnerable to natural disasters? The answer lies in a combination of geography, poverty, and governance. The country is located in a seismically active region where earthquakes are a recurring threat. But unlike wealthier nations with modern infrastructure and disaster preparedness systems, Afghanistan has little ability to withstand or respond to such shocks. Most Afghan homes in rural areas are built from mud bricks, affordable but fragile. When earthquakes strike, these structures collapse instantly, trapping residents inside. Poor roads and limited access to emergency services mean that survivors often have to wait hours, even days, for help to arrive. Moreover, Afghanistan is grappling with severe economic sanctions, limited international recognition of its current government, and ongoing internal conflicts. This has crippled its ability to maintain disaster preparedness programs or stockpile emergency resources. When disaster strikes, the nation is forced to rely heavily on international aid. But political barriers often slow that aid from reaching the people who need it most. In the wake of the earthquake, Afghanistan's Taliban-led government made an unusual move, an open and urgent appeal for international assistance. Officials admitted that the scale of the disaster far exceeded their capacity to respond. They called on foreign governments, humanitarian organizations, and the United Nations to provide emergency relief. This plea underscores the severity of the situation. Despite political tensions and the reluctance of many countries to engage with the Taliban, the earthquake has forced the world to reconsider. For survivors trapped beneath rubble or waiting for food in makeshift camps, politics is irrelevant. What matters is immediate help. Humanitarian organizations like the Red Crescent, Médecins Sans Frontières, and the United Nations relief agencies have already mobilized. but their efforts are constrained by logistics, funding, and the challenges of coordinating with local authorities. Time, however, is running out. This disaster raises a critical moral and political question. Should humanitarian aid be influenced by politics? Afghanistan has been politically isolated since the Taliban takeover in 2021, with foreign governments hesitant to provide direct assistance. Yet, in moments of disaster, the lines between politics and humanity blur. Experts argue that international aid must rise above political disagreements. Human lives should not become collateral damage in global power struggles. If the world delays in delivering aid, the death toll will rise not just from the earthquake itself, but from starvation, untreated wounds, and disease outbreaks in crowded camps. For donor countries, this is a test of compassion. Will they extend a hand to a population in desperate need, even if they oppose its government? Or will political hesitation lead to preventable deaths? The answer will reveal much about the state of global solidarity in times of crisis. Afghanistan has faced earthquakes before, and the lessons have often been painful. In June 2022, a quake in Paktika province killed over 1,000 people. Despite promises of international aid, much of the assistance was delayed or insufficient, leaving survivors to rebuild with little support. The recurring cycle of disaster and inadequate response highlights the need for long-term solutions. Beyond emergency relief, Afghanistan requires investment in earthquake-resistant infrastructure, early warning systems, and stronger disaster management strategies. These are not luxuries. They are lifelines that could prevent future tragedies. The world has seen how countries like Japan, which experience frequent earthquakes, have minimized casualties through preparedness and modern construction. Afghanistan, however, is far from achieving such resilience. Without global assistance and investment, the cycle of destruction will continue. The earthquake's impact extends beyond the immediate loss of life. The destruction of homes, schools, and businesses will deepen Afghanistan's economic crisis. Already one of the world's poorest nations, Afghanistan relies heavily on subsistence farming. With crops destroyed and livestock buried under rubble, food insecurity is expected to rise sharply. Social structures, too, are strained. Displaced families now live in overcrowded camps, where women and children are particularly vulnerable. Without proper sanitation, outbreaks of disease are highly likely. Education, already disrupted by years of conflict, faces further setbacks as schools lie in ruins or are converted into temporary shelters. This disaster will leave scars not only on the landscape, but on the fabric of Afghan society. Recovery will take years, and without global support, it may never fully happen. The Afghan earthquake is a reminder that humanity is interconnected. Disasters do not respect borders, and in a world already grappling with climate change, migration, and conflict, compassion is more important than ever. The international community must act swiftly, not only with emergency relief, but with long-term commitments to rebuild lives and strengthen resilience. Aid must be coordinated, transparent, and delivered directly to those in need. Donor countries, NGOs, and international institutions must put aside political differences and focus on saving lives. This is a chance for the world to demonstrate that humanity can rise above politics in the face of tragedy. The earthquake in Afghanistan is more than a natural disaster. It is a test of global compassion and solidarity. The images of destroyed villages, grieving families, and desperate survivors are a haunting reminder of how fragile life is. For Afghanistan, this is a moment of profound suffering. For the world, it is a moment of decision. Will the international community respond with urgency and empathy, or will politics and hesitation allow the suffering to deepen? The survivors of Afghanistan's earthquake wait for an answer. The call for help is urgent, and the time to act is now.